Hi, my name is Jennifer Davis, and I am a student with Jacksonville State University, and I'm in part of the STEP program that includes RN to BSN, and this is part of my PEEP project for NU 456, and one of the things that I'm including in it is this video. It's about using the incentives barometer. My overall project is about preventing pneumonia in the elderly, as it is one of the leading causes of death and hospitalizations for the elderly. And a part of the other parts of my project include a PowerPoint presentation and a pamphlet. So enjoy the video. And today is 11/11/2013. Thank you. Okay, so here's the question.
Why should I use an incentives barometer?
Well, Catherine, an incentives barometer is commonly used after surgery, but people who are at risk of airway or breathing problems may also use one. These people include people who smoke or have lung disease. This may also include people who are not active or cannot move well.
Where do I get an incentives barometer?
An incentives barometer can often be purchased at a medical supply store or home oxygen supply store. These require a prescription from your doctor and usually run about $10 to $15.
How many times a day should I use this incentives barometer?
How often you use an incentives barometer really depends upon the condition of your lungs. You can use it up to 5 times an hour or up to 3 times a day, depending on what you need.
Are there any side effects to this incentives barometer?
The only known effect of an incentives barometer would simply be healthier lungs.
Hi, this is Bob, and he is 80 years old.
80 years old.
That's right. And when were you diagnosed with valley fever?
3 months ago.
3 months ago. And what did the doctor tell you about it? Did he say that your lung capacity had diminished over time?
I have scar tissue in my lungs and they have diminished, yes.
Yes. So you have home oxygen, right?
Yes, ma'am.
And how often do you use it?
Frequently.
Frequently? And do you use it because you get out of breath from activity, or is it at rest?
From activity.
From activity, good. So that's he also has other medical history such as diabetes, right?
Correct.
Any high blood pressure?
Yes.
Yes. And you take medications for all of that?
Correct.
Good. So he is my patient, one of my patients, and I'm going to have demonstrate the incentives barometer. I'm doing, okay. So the first thing we're going to have him do is do some pursed lip breathing. So just do some in through your nose, out through your mouth. Good job. Okay, good job. So go ahead and take the incentives barometer, and let's do a close-up of it here. He's going to start out at 200, and then we're going to count how long he holds that ball up and then multiply by that. So whenever you're ready. 1,000, 2, 1,000, 3, 1,000, 4, 1,000. So he was able to keep it up for, so it would be 4 times 2 is 800. So that's really good for you. Considering. Good job. So this is Catherine. Hi, Catherine.
Hi.
And her medical history includes, do you have any chronic diseases like diabetes? No?
No.
High blood pressure?
Yes.
Okay. Do you take medication for that?
Yes.
Okay. When you get out of breath, how is that with activity or at rest?
Activity.
Activity. Do you have any diagnosis of lung issues, COPD, emphysema,
The doctor
asthma?
has diagnosed me with asthma.
Asthma. So, so you ever used an incentives barometer?
No. I've used the other type, but not this.
Oh, you haven't used that one?
No.
You used the one that you blow into, you mean?
Yes.
Okay. So, do you know what your lung capacity is? No. So, why should you use an incentives barometer? Do you know?
He just asked me to use it, and I did. So I don't know what the assessment was, but he hasn't done it.
So, Catherine.
Okay, before you start,
Sure.
One of the things that the doctor did was give me a test, but he didn't give me one of the things to keep doing.
Oh, really? Mm-hmm.
And as I've gone along, and he's taken chest X-rays, etc., he said that I have an asthma condition more than I have COPD. He doesn't see me as a COPD.
That's good.
So he's saying that the breathing machine that I use will help me with that capacity.
And what is that breathing
Because
machine?
when I go out in bad weather, for instance, the weather is very dusty and it's a bad average day, and they give a warning, that's when I have some difficulty, but I can still manage. It's just that he never gave me the machine to use.
Yeah.
Are you filming me?
Yeah, it's really interesting.
Oh.
So what home things do you use to control your lung capacity, your asthma?
Inhalers. I have Zopanex, inhaler for emergencies. I use Symbicort twice a day.
Do you have a nebulizer?
Yes, but I don't use it frequently. I do use it on days that I'm not doing poorly. I will use it with frequency, maybe 3 times a day. But on an average, I may do it once a day. Yeah.
Okay. Cool. All right. Well, let me see what you can do with that. Let's see what you have in you. Until you can count.
I couldn't take a deep breath.
Try it again. Be slow. There's no rush.
And what you want to try is not do it as fast as you can, just enough to do it.
3.5.
Okay.
So you want to try it again?
No.
Okay.
That's
You did
about
pretty
it.
good. You did about 3.5 times 2 is 700. So that's good. 2,000, 3,000.
That was 4.
It's 4. Good job.
I probably average about 4, I guess.